Welcome to this episode of the Biology of Trauma podcast. I'm your host, Dr. Aimie. Studies are confirming that common mental health symptoms like depression, anxiety are associated with brain inflammation. And I want to share with you two often overlooked sources of that brain inflammation that cause emotional fragility. Things like toxins from mold and Lyme. And more importantly, the feedback cycle that they create with stored trauma in the body. This is important because we have a mental health crisis with unprecedented numbers of anxiety, depression, and its relative burnout. And while we can often assume that it's a person, place, or situation that's causing us stress, we need to consider the other factors, those biological factors inside, and things like the mold exposure and undetected chronic Lyme disease. Many are unaware of the association between the two, and without knowing to investigate, can go on recommended mood and sleep medications, not knowing that they have other options, and getting on a medication that also causes some problems and are difficult to get off later. And so the real question comes down to not just do we have mold or Lyme, but what is the relationship between that and stored trauma? One of the questions we'll be answering in this episode is, how does mold and stored trauma in the body create this feedback cycle that makes each susceptible to the other? My good friend Kirkland Newman is my guest for this episode. She is a journalist, entrepreneur, and philanthropist who faced postpartum depression and couldn't find answers in the traditional healthcare approach. So she did her own research and created Mind Health 360, an integrative mental health website to be a resource for others who are also trying to find mental health solutions. In this episode, you'll learn how trauma responses from adverse childhood events cause brain inflammation, how that brain inflammation can predispose us to a long-haul syndrome with mold or Lyme, what mold actually does to our nervous system to lead to anxiety and depression, how we might know if we have mold or Lyme toxins, and how to approach our trauma work or therapy differently when we have mold or Lyme toxins, and the different modalities that we will want to integrate for therapy. This is such an important topic for today, for therapists, health practitioners, and the self-help seekers. All of us need to be empowered with this knowledge of mold and Lyme and its relationship to brain inflammation and our emotions. So let's get started. So Kirkland, welcome. I almost don't even know where to start because, my goodness, you've had your own experience with postpartum depression and had to figure out that it wasn't just emotions, that there was biochemistry behind that. And then there's been this recent thing with mold with you and the anxiety and internal stress that's been activating your nervous system. But even more than that, like even just looking around, there's so much need right now to talk about mental health and understanding these internal stressors. So from your standpoint and viewpoint, what are you seeing happening in your own England, London area, but even around the world that makes this so much more important than it has ever been before?
That's great. Thank you so much, Aimie. I think your approach is fantastic, and I think your course is amazing. So very, very excited about that. And I've always been fascinated by the neurobiology of trauma because I think it's so interesting. You know, we talk a lot about trauma and psychological trauma and adverse childhood experiences, but we don't really think necessarily about what that means from a biochemical perspective and what that means, you know, under the hood, essentially, like what it's doing to our physiology and how our physiology can predispose us to trauma. So I think what you're doing is fantastic. In terms of what's going on at the moment with mental health, it's pretty dire. And I'm especially concerned about young people, adolescents, teenagers. The latest statistics that I've heard are really, really scary in terms of, you know, self-harm, suicide, depression, anxiety, off the charts numbers. And I was just listening the other night to one of the heads of the big girls' schools here. Eating disorders are through the roof. And we know that eating disorders, for instance, are probably the most dangerous form of mental health in the sense that they lead to the highest mortality. And so I think, you know, the lockdown, COVID, the anxiety, now the war in Ukraine, there's so many things that are contributing to stressing us out. And, you know, we know that chronic stress is incredibly dysregulating to our nervous system. And So we can talk about trauma as being something that's, what is trauma? And so essentially there are different types of definition. I mean, you were talking earlier about the fact that it's sort of the system being overwhelmed and unable to respond to something in an appropriate way because it's overwhelmed and it can't keep up with what's happening to it. Another possible definition, which in fact comes from a writer called Benjamin Fry, who wrote The Invisible Line, is that it's essentially unfinished energy that's stuck. And so trauma is only trauma because it's stress that's become stuck in the system. So it hasn't been able to finish, to complete a response. And therefore it's disrupted homeostasis. And, we know that homeostasis is the best way to heal and to make sure that that we're in optimal health, both mentally and physically. But when something disrupts that homeostasis, whether it's past trauma from adverse childhood experiences, trauma, neglect, abuse, or whether it's the chronic stress that we've been under, the sort of anxiety, the being bombarded by 24/7 bad news, essentially, this is disrupting our homeostasis. And so what happens is that, there's a cascade of biochemical effects that come from that sort of chronic stress or from trauma, where we know that essentially it leads to inflammation. So, a lot of inflammatory cytokines. It leads to higher cortisol and adrenaline, and then eventually lower cortisol. We know that it leads to, possible brain atrophy. So atrophy in certain parts of the brain, which they found in people who have PTSD, that they have, smaller hippocampi or smaller different parts of the brain. We know that there's a disconnect often between the left and right hemisphere. So they've done tests where they've seen that, sufferers again from PTSD have disrupted communication between the right and the left hemisphere. So, we know that there's a very clear physiological effect of this chronic stress and trauma in our systems. And the interesting thing is when I had postpartum depression after both my boys, I thought, what was I offered? I was offered SSRIs, selective serotonin uptake inhibitors, and CBT, cognitive behavioral therapy. And neither of them worked. They didn't work for me. And I was flabbergasted because I said, I've never had depression or anxiety before. I've had anxiety, but I've never been depressed to this level. And I thought, surely there's something abnormal about this. Surely it has something to do with the fact that I've just had kids. But, the only response of my doctors was to offer me these drugs and offer me CBT. And not one of them said, well, let's test your hormones, or let's look at your inflammation markers, or let's look at your nutritional levels, or let's look at your toxins. It was only when I discovered functional medicine in America, and of course, I'm based in England, and I started following doctors of functional medicine like Sarah Gottfried, and, who's a wonderful OBGYN who was talking about adrenal issues and gut, et cetera, that I thought, okay, why do more people not know about this? And essentially, what interests me is that there is a huge physiological response and that can trigger a depression or an anxiety. So you can have a zinc copper imbalance. You can have an IUD leaking, which can give you too much copper and then lower your zinc, which can then lead to sort of psychosis or, some really severe mental health symptoms. And it's a purely physiological issue. And what you were saying earlier, which I thought was fascinating, was that, if you're born and then you're in an environment where you have a sort of genetically an adrenal, or because of what's happened in utero, you have an adrenal insufficiency, or you have, inflammation, or you have an infection, that will predispose you to reacting in a more sensitized way to what your experience is. And as we were saying also, I think it's important to mention that trauma is not in the event, it's in the way your body responds to the event. And which is, of course, what Peter Levine talks about a lot. And, each person will respond to an event differently. And trauma only is trauma if the homeostasis is disrupted, the energy is then stuck, and then the nervous system becomes dysregulated. and health and healing and resting and digesting are all compromised. And so our system is just, unable to heal as efficiently. And it unfortunately leads to long-term health issues, cardiac issues, metabolic syndrome, mental health issues.
I'm so excited to have this conversation around biochemistry because what we both want to share with people is just this idea of that your biochemistry is actually going to create the capacity for your system to respond to situations. And so it's not only that trauma is going to cause downstream effects, though that is also true. You've recently had an exposure to mold, and your nervous system is compromised in its ability to respond appropriately because of the inflammation that is surrounding your nervous system and this cell danger response that it seems to have activated. Like your nervous system is primed for reactivity and sensitivity, and that is disrupting homeostasis. So you can have disruption of homeostasis first, and that sets you up for this trauma, which, yes, like there is a trauma response, right? And it needs to be completed in order to discharge that energy that we get when we go into the sympathetic and there's that huge adrenaline. And if that's not discharged, like that gets stuck in the body. But then when it is stuck, it further causes more downstream internal physiology. And so I would love for you to even just be able to share more on your experience with the mold and some of the symptoms that you've had, because I think that, again, many people would just immediately go to the emotional and not connect the two and not understand that, wait a second, even though I'm going through my life and I think that that person or my job or my boss or my kid is what's stressing me out, what's actually stressing me out are the internal stressors that I have. This neuroinflammation, that's the real source of stress. And we just haven't had the knowledge to look inward for those sources of stress.
I think that's so important because, we think of stress as emotional and psychological, but stressors can be very physiological, pollutants, toxins such as mold or, plastics or heavy metals. And stressors can be a deficiency of nutrients, from our food. So a stressor can be too much sugar in our diets, too much processed food. A stressor can be an infection. A lot of people get infections. And one of the interesting things about COVID, in fact, I was talking the other night to the head of psychiatry at Oxford University, and she's doing research into the effects of various viruses on schizophrenia, and showing that actually schizophrenia can be very much improved if you deal with the viruses that are causing it. And
imagine that.
Imagine that. I mean, and so from my perspective, and what's really interesting is that, it as you were saying, it's like this vicious circle, essentially. It's like, chicken and egg, what is starting what? If Neil Nathan, who writes a lot about mold and talks a lot about mold and is wonderful, was saying, if your limbic system, if you're inflamed, if you have neuroinflammation from traumatic experiences in childhood, you're going to be much more susceptible to Lyme disease and to mold issues. So if you could actually repeat that, because I don't want people to miss that. That is a huge point around the biology of trauma that people need to understand. Could you say that again? Absolutely. So what Neil Nathan was saying is that, the neuroinflammation that's caused by childhood trauma, by adverse childhood experiences, by chronic stress can predispose you to having Lyme disease or other sort of tick-borne diseases.
It makes you a better host. Exactly. For those types of infections.
Exactly.
It's a fascinating topic.
Exactly. And so, it's really important to deal with both, to deal with your trauma and your nervous system and trying to regulate your nervous system and get it back into homeostasis so that it's more adaptive. And also to deal with the biochemistry. So for instance, from my perspective, I am struggling with a sort of mold exposure at the moment. And my symptoms are very scary. I mean, I have a lot of anxiety. And at first, when it started happening, my first symptoms were anxiety. I mean, through the roof anxiety. And I thought, this doesn't feel normal. Like this doesn't feel, it feels physiological. It feels like there's something there's no reason for me to be super anxious. I mean, sure, we have all the stressors of normal life, but it just didn't feel quite right. And then I started developing muscle twitching and tremors and all these weird symptoms. And of course, that freaked me out even more. And I thought, what if I have a neurodegenerative disease? What if I'm dying? And then that created more stress and anxiety. And eventually, after, 6 months of investigation or 4 months or something, they found that I had very high levels of mold. Then we found that my house was very moldy and full of mycotoxins. And now I'm in a situation where, I mean, sure, I have had definitely some childhood trauma and neglect. Maybe that has made me, and then I had quite a stressful time where I was opening this integrative mental health clinic in London. And possibly that has predisposed me to being more susceptible to the mycotoxins that were in the atmosphere that I was earlier able to process. I grew up in a moldy home and I never had any problems. But I wonder also if it's cumulative. I'm now 50 years old and it's, I've been exposed a lot. And so I think the problem is our system as we age gets probably less able to deal with all this stuff. And yet at the same time, we're accumulating more and more exposures to both psychological and physiological stressors. And so it's sort of this perfect storm. And that's why people, get sick. That's why they have these sort of age-related chronic diseases, I think. So it's
so much of it really comes down to the nervous system, right? Because when we can look back at even childhood, it would have started this pattern in your nervous system of insecurity, and that leads to inflammation, and then that leads to disease later on, and then that leads to more trauma, because even just there's this trauma of being sick and ill and not feeling well. Right. And so, like you say, it just ends up accumulating, and being able to see how so much of our power really is in that nervous system, and being able to have the tools to bring that nervous system back into parasympathetic, but really be able to build its capacity again after having been burdened with everything that's decreased its capacity. I feel like it can hold a lot, right? Like our systems are designed to hold a lot, and they do, but there comes a breaking point. And when that breaking point happens, we're surprised. We're like, where is this coming from? I never used to react to mold this way, perhaps, or for other people, it may be food sensitivities or other things, right, that they're noticing, or maybe some of the postpartum depression or anxiety, like, where is this coming from? Well, it's actually been building for a long time. You've just been able to ignore it until now.
Exactly. And I think that's absolutely the case. And what's also very interesting to me is that the way to treat it, the way to deal with it. So I'm working with a somatic therapist, and I always say, well, I've got all this mold and I've got all this muscle twitching. And she's like, yes, but let's come back to your nervous system. Let's come back to your body. Tell me about where do you feel this? And I'm always like, okay, but that's the psychology. What about
I feel it everywhere.
Exactly. So I think the key is in terms of healing. And that's why I call my website, 360. I think you really have to address both. So you have to address the nervous system, both from a physiological perspective by diminishing the stressors, the toxins. So you take binders, you try and reduce inflammation by, taking the right supplements, but also you work in a somatic way with somatic therapies to try and really calm the nervous system, to calm the limbic system and this sort of reactivity that's going to create this vicious circle of inflammation and this perpetual sort of chronic inflammation, which, as we know, leads to so many different diseases, both mental and physical. So,
well, like I told you before, like you are telling my speech for me, right? Like as a medical physician, I have seen, like, you have to do both. Even I do not just address the biology and the biochemistry, because the 21-day journey is actually all somatic work, Kirkland. So I take people through 21 days of somatic work before we then address their biology, because first of all, I need to have them aware of their nervous system, able to track their nervous system, even be able to be aware of the sensations. Most people are so disconnected from their body, living in their head, that they have forgotten that they even have a body. So we got to establish that first, but then they're there. And it's kind of like the same thing that you're experiencing with your therapist, right? It's like, there's so much that's physiological here. Like, yes, I'm in my nervous system, and it is all about my nervous system. And there's some biochemical things that are really affecting my nervous system that I've got to go address. And that's what I love about my work, is that I really do get to blend those two. And because of that, and I know this has been your experience, like see magic happen when you blend those two.
So true. And it's interesting because my boyfriend runs a trauma clinic, and I always say, you can do trauma work and therapy until the cows come home. But I mean, if somebody has, super high
inflammation,
and it's the same with addiction. A lot of rehabs around the world, they don't look at nutrition or infections or toxins. And so, they expect people to sort of white knuckle through sobriety with the 12-step program. And essentially, if we support people's physiology with the right supplements, with the right sort of, not pharmacological, but it could be herbal, or it could be supplements, or it could be, there are many different modalities of intervention with nervous system therapies and somatic therapies. I think that's really, then you have a chance for real sustainable healing and recovery, because it's both. And I think part of the problem is a lot of the healing modalities that are there at the moment are either sort of one or the other, and they need to be integrated. And I'm very passionate about that, because I've seen that that's really the only thing that works long term. And I think people get too siloed. They get very caught up in their own modality, and they think, okay, it's all infections, or it's all, toxins, or it's all, everybody needs to do somatic experiencing. But actually, it's really about combining the whole system. And I mean, the body's such a beautiful, finely tuned instrument, and we're so good at healing. And, I was talking to Stephen Porges the other day. He's wonderful. And he was talking about how, vagal tone, and how, the vagus, the health of the vagus. I mean, 80% of the vagal nerves are afferent, meaning that they go from the body to the brain. And which is interesting, because so many of our approaches, CBT, are from the top down, right? From the brain to the body. But actually, it's not the way our body works. It's very much from the body to the brain. But he was talking so eloquently about how we heal so much better, when we're a state of homeostasis, which for him is very much about social engagement. So, the ventral vagal tone is all about social engagement, and how the nerves, the cranial nerves of the face are connected to the heart, and how we have to learn to self-regulate and co-regulate with other people in order to really calm our systems and be in states where we can really heal, and have that state bring us, ourselves and others, actually back to homeostasis, because our bodies know how to heal, but they do need support.
And I love that you use that word, Kirkland, because that's the same word that I've landed on. It's not fixing, because nothing's broken. It's coming in and providing support. And when we can provide support, both through the somatic work and the biochemistry work, it does result in this, again, lasting changes. And what I have seen so often is people will, go to yoga because they're stressed out, and they're fine when they're on the yoga mat, but then they have to get off their yoga mat, right? It's like, how do we make this sustainable? Well, we've actually got to rewire the nervous system, and it will do that by itself when it has everything that it needs. And we just get to provide it that support.
Exactly. And what it needs might be, it might be sort of co-regulation with another human being. It might be meditation. It might be somatic therapies, but it might also be a specific supplement or an anti-inflammatory supplement. So again,
might be bringing that copper down, might be.
Exactly. And so just as the cause can be both physiological and psychological, the solution also has to be both. And I think that's so important, because, and it's hard to cover all the bases. And there are very few practitioners who are able to keep their eye on so many balls, essentially, and look at all these different aspects. And I think, it's very important to work also as a team, and to have different people who are really good at certain things, and to bring them together so that they can really help support the healing, whether it's somatic or whether it's, sort of a somatic therapy, or whether it's a supplement. People have different areas of expertise, and it's very hard, I think, to expect one person. I know you do a hell of a lot on your own, which is brilliant, but it's hard to sort of cover all those bases and be trained in all the somatic modalities, as well as know which herbs and which supplements to use. to reduce inflammation, for instance. So, it's tricky.
It is. And I would say that one of the things that I have intentionally done is bring in a lot of providers. So one of the beautiful things that is developed out of this biology of trauma, even the certification course, is that the providers going through it are of so many different backgrounds, Kirkland, so many different backgrounds. And we've been able to form an integrative, multidisciplinary team that meets to discuss cases and clients. Because again, like I've got my view and my mindset. And yes, I have tried to diversify my training as much as possible. And yet I don't know everything. And so having an acupuncturist, having a chiropractor, having a trauma therapist, and we're all sitting there in this multidisciplinary team. Of course, it's all online, right? In our days, we're all online. But even that's the beauty of it, having people from around the world being able to all sit on this panel of a multidisciplinary team, talking about the clients that are coming to Trauma Healing Accelerated for help. And it's like, yes, and you're going to get this total wraparound multidisciplinary view on you, like how powerful and what a feeling of support, right? Yeah. And you feel this like relaxation in your body of, oh, like I've got so many people looking out after me, rather than this bracing of, okay, I've got to figure this all out myself. And I feel completely lost, because that is the experience of so many people. Kirkland, this has been amazing talking with you about biochemistry. It is rare that I get to find somebody that I get to geek out over biochemistry with. So this has been a pleasure.
Well, I feel likewise, totally. I mean, it's also rare to find somebody who just sees eye to eye in terms of that whole 360-degree approach, which is so important. And it's also very rare to have somebody who's as trained as you are in so many different modalities. And I think, that's very exciting. And I, for one, would love to come and see you. So it's lovely to talk to you and be here. So thank you.
Thank you. And let me just also thank you for the work that you're doing in the world. This is not something that you have had to do, and yet you have seen the need and really stepped into that, and let your experience even guide part of that in creating what really needs to be a 360 view of our mental health.
Yeah, totally. Thank you.
Thank you for tuning into this episode of the Biology of Trauma podcast. If you would like to know more about biochemistry, nervous system, mental health, then I have resources for you in the show notes. One of the things I want to share with you are the 3 most common biochemical imbalances that cause nervous system dysregulation and will keep us stuck. And these are common in those people that I am seeing. And so we want to know how to assess for them and know if testing might be helpful. I have all of that in this free guide on the 3 most common biochemical imbalances in those with stored trauma in their body. If you are wanting to take action, well, then you might want the Brain Inflammation Library. This is a video library that I have put together, not only with the science of brain inflammation, but the practical, here's what to do and also what to take. If you just want to know what to take, well, then I will share with you my personal brain inflammation protocol, and that will give you a place to start for keeping brain inflammation calm down, or if it's active right now, to get it into a calm place. I do have a few related podcast episodes that you will be interested in if you liked this episode. Episode number 90 is Beyond Talk Therapy with Dr. Robert Lustig, addressing the biochemical basis of behavior and changing our responses. And you will want to check out the YouTube video on the copper to zinc ratio you need for healing. Now, the copper to zinc ratio is also very important for that postpartum depression or anxiety, so that will be one you want to check out. I am here to save you time and money by bringing you practical information that will help you accelerate the trauma healing journey. So please take a moment to subscribe, rate, or leave a review. Your feedback is how I know how to help improve this podcast, bring you great content, and have others be able to find information that will change their life as well. I'm your host, Dr. Aimie. Until next episode, lots of love.